and get us started with our COVID-19 update call today. Molly, did you want to kick us off?
So Molly, she is muted. She didn't put in her PIN number, so I can't unmute her. So Molly, if you put in your PIN, then I can unmute you, or you can try through the computer audio.
Okay, so we'll give Molly a second to get that sorted out. Looks like you might be muted on your end, Molly.
Hey, Melissa, you might want to keep going. I'm going to see if I can help her with this.
Okay, great. So I will just go ahead and get started asking if anybody has any questions that they want to chat in that they're hoping that we're going to cover today, or any topics that they're hoping we're going to cover today. We do have quite a full agenda, and it's pretty timely information, so I'm glad to see that there's 62 people on the call and that it keeps growing. So just to get us started, if you want to chat in your questions, some things that we've heard coming up around the state, some questions that we've gotten so far this week are, do housing sites have plans for how to get air conditioners installed, especially for those people that have a critical medical need for the air conditioner? Many housing hosts currently are only doing emergency work orders. So it might be something that isn't even on their radar yet, because they're not normally installed until the beginning of or the middle of April, but it's coming. It's something that we need to consider. I'd love to hear if people know what's going to happen at their agency. Some participants are running out of quarters for the laundry, and we're just curious how people can get more quarters if they're staying at home, or if they can't make it out to the bank, or if the bank can do this through the drive-through, or can they walk through? But it is an issue if you have a quarter machine and you're running out of quarters. How are you going to be able to do your laundry? And then just questions about the new order around the cloth masks. So hopefully we can get to some of those questions today, and if not, we will certainly try to follow up with the follow-up email or talk about them next week. I don't know, Molly, if you were able to join us. I do want to give you a chance.
I am. Can you hear me?
We can. That's wonderful. Thanks, Molly.
Yeah, sorry about that, you guys. I forgot to use my audio code, so there you go. You guys are all probably well ahead of me on that. So welcome, everyone, to our weekly call. Again, amazing to see how many of you are attending. We have found this venue to be incredibly helpful for us to be able to help you through this really unprecedented time. So thank you for being part of this. I want to thank my SASH administrative staff that put these together. They put a lot of time into it, and it's been really, really positive. So thank you. Before we get started or continue getting started, I wanted to take a moment to acknowledge that we lost a real giant in the affordable housing world over the weekend. Susan Ainsworth Daniels, who was the Associate Director of Resident Services at Champlain Housing Trust, died over the weekend. It was not COVID-19 related. I don't have other details, but I just want to be clear about that. But Susan had worked at Champlain Housing Trust for many, many decades. She was a social worker. She was very much, committed and passionate about helping those less fortunate. She really made sure that SASH came to Champlain Housing Trust. She, was one of the first people that I met with about bringing SASH to Champlain Housing Trust. And for those of you that know Susan, you won't be surprised that her response to me was, "Of course, we're going to do that." That is just who Susan was. She was, always a yes. How are we going to get this done? So it's a big loss. I wanted to just acknowledge it for, those of you from Champlain Housing Trust. Our deepest sympathies go out to you because this was a major loss. So just wanted to acknowledge that. And, there is a lot of loss going on right now. And I think it's important for us to pause and to, in this time when we can't be together, literally cannot be together, it's all the more important for us to acknowledge these kind of losses. So with that, I will pass it on to Melissa for us to continue. Thanks.
Thank you, Molly. And I just want to echo your sentiment. I had the pleasure of working with Susan for almost the past 20 years, and I was just such a fan. She was always positive and just so wonderful to work with. It's truly a loss, and thank you for taking the time to acknowledge that. So I'm going to move us along because we have a lot to cover today. I want to start us with sort of an update on where we are. All of this is the information from yesterday, mainly because numbers are normally being updated at 1 o'clock in the afternoon. So I did see Vermont's numbers were updated just now, but basically the only thing that changed is that we had more people testing positive. So I think it's up into almost the 600s now. We've had 22 people that have passed away in Rhode Island. There's been 922 positive cases, and it looks like 25 fatalities. And then in Minnesota, there have been 935 positive cases with 29 deaths. So I want to just share that each week to keep us kind of grounded in why we're having these meetings. So updates since last Monday. Casey, I think you wanted to talk to this.
Sure. Hello, everyone. I'm just finding my notes here. A couple of updates. There's a lot of surge hospitals happening. I know in Vermont. I'm not sure what's happening in Rhode Island and Minnesota around surge hospitals, but there's tent hospitals and hospitals in alternative buildings being set up both to take care of people who do have COVID-19 and then also recovery centers and treatment centers for people with COVID-19. So those are going up around the state in Vermont. In Vermont, we've gotten, I guess it's not an order, but it's a request that everyone wear masks in public. And I think that there is the potential for those guidelines to come from the CDC as well, more nationally, which of course means a huge increase all of a sudden in the requests for masks and everybody wanting masks. I know there was in the question section at the beginning, one thing that came up is people feeling like if you wear a mask, for example, to deliver them food, that there's a perception that you're wearing the mask because you're afraid of getting it from the person you're visiting. And so working to kind of change that perception to I'm wearing a mask to protect other people, not necessarily to protect myself. And that perception on the masks is something we can help people understand, that when people come to our participants' door wearing a mask, it's to protect them as a high-risk population. There in Vermont, we have travel restrictions in place, and I assume that's fairly across the board nationwide, but I'm not sure about that, but asking people not to travel between states. One other thing that has come up is very restricted visitors being allowed at hospitals, so not being allowed to go with a loved one into the emergency room or to visit them in the hospital, except in certain cases, for example, with pediatrics or in obstetrics. I think some hospitals were making exceptions for hospice patients, non-COVID-19 hospice patients, but I'm not sure if that is still the case. So that really affects our participants who rely heavily on their families to get information from the doctors for them and to be a translator in that way. So those people are no longer allowed into hospitals. As I'm sure you know, our unemployment numbers are soaring across the country. Stimulus checks are promised but may come very slowly. So our people who are counting on that stimulus, may not get it for quite some time. And then there are concerns about changes to public transportation, and I'd be interested for people to chat in kind of what they have heard, and to definitely explore that. Do you know if your public transportation agency in your area is making any changes in response to COVID? We know here in Chittenden County that SSTA is refusing transport from a senior living setting with a positive case, and they're needing any manager approval for any senior living without a known case. So good to know what's happening in your area so that you can help your participants who need to get transportation out of those facilities.
Hey, Casey, we haven't had any comments in the chat about that just yet, but there's been quite a few people just typing back and forth about masks. And Sarah asked if there was, if you needed to wear masks while you're taking a walk in the neighborhood, or is it only just necessary when you're inside in public areas? Do you know?
I don't know. I believe that Governor Scott has requested people just to wear a mask when out in public. So, you know, if you're taking a walk on your deserted street, I guess that's probably not necessary. But if you might meet a neighbor and have a conversation with them, then wearing or having a mask with you would be appropriate.
Yeah, this is Molly. I heard the same thing, that if there's a chance you won't be able to maintain 6 feet of social distance when you're on your walk, then you want to have the mask. But if you're confident you're going to be alone in the woods, then it's not necessary.
Great. Thank you so much. And keep those chats coming in, because anything that we don't mention on the phone, people are still able to read. And I do read every chat afterwards just to make sure that we've covered any questions. So thank you all. And also, I did just want to say that Dana mentioned that Rhode Island is also setting up surge sites. So that was something that we weren't sure of. And now we know. Thank you, Dana. So I wanted to talk, I kind of made this chart to show visually where we're at right now, because it personally feels like this has been going on forever, but really it's only going on 2 weeks right now since the stay safe at home orders have gone in place for all 3 states. So we're nearing this 2-week mark. We'll hit that 2-week mark for every state this week. And then we're also nearing the proposed end date for the stay-at-home order. Now we know the odds are good that those are going to be extended. I wasn't able to find anywhere online that showed that they had yet been extended for each state, but we know it's coming. Casey pointed out this week, oh, it's time to stretch. I could really use that. Casey pointed out this week that we will be reaching the 2-week mark since the order went in place in all 3 states, and we're things to consider about this are that people may be running out of provisions that they originally obtained. So many people, myself included, bought supplies for 2 weeks, but I've been using them, you know. And the idea was to buy supplies for 2 weeks and sort of set them aside so that if you were to become ill with COVID, you would have enough to not leave your house for 2 weeks. So when you're talking to people, when you're completing those COVID-19 individual assessment plans, please be checking in to make sure that they still have enough supplies. And this is everything from groceries, medications, toiletries, incontinence supplies, laundry detergent, like you name it, whatever they would need to get them through 2 weeks without being able to leave their home, because that's the ask. If somebody is positive with COVID, they're being asked to literally shelter in place for 2 weeks. So I know that, like I said, I went and I bought the 2-week supply, but I've been using them, not really thinking about, oh yeah, I need to keep this separate. I'm sure some of our participants have too. So just something to keep in mind when you're talking to people. Do they have enough if they were to get sick tomorrow to get them through 2 weeks? And if not, they might want to get those supplies now while they can, if they can. Casey?
And one other comment on the laundry issue too is that when, especially for our folks who live in congregate housing, it's not just having enough laundry soap, it's actually having enough laundry in their apartment so that they don't have to use the communal laundry area for those 2 weeks. And that may mean hand washing underwear in the sink, but making sure they have enough clothes for that 2-week period without having to go out into any communal space.
Yes, thank you. Good clarification.
So for this slide, kind of what to expect when there is a COVID case in your building. And again, just a reminder that we should all be assuming that they're there, that these people, that we already have participants in our building, that there has been, as you know, a real shortage of testing. But you will not be getting a hazmat team. So this original response, this is a photo from Washington State for the nursing home where there was original response to cases there. This is not what is happening when you have somebody sick in your building. So assume you already have positive cases there now. The way you may find out might be patient ping or from Epic. If you are on Epic, VDH has a plan to inform property management if a participant, but that's only going to work if a participant correctly identifies themselves as living in congregate housing and gives that information to them, and then VDH would be reaching out to property management. That may or may not be super timely, depending on how quickly that information is gathered, and then what is done with it. VDH also may not be doing contact tracing, so kind of figuring out who that person has had contact with. That's changing, so it's hard to know exactly what is happening. And again, I'm not sure in Rhode Island and Minnesota if their Department of Health is still doing contact tracing, but a lot of health departments are moving away from that because there's just so much in the communities. So when there is a case in your building, don't forget HIPAA. It's very important to protect that participant from participant's privacy. In most cases, the participant will be sent home unless they're critically ill. So they may go to the hospital, they may test positive for COVID, but they're still going to be sent back into your building and then asked to self-isolate in your building. Some hospitals, I think every hospital has a little different determination on who they keep and who gets sent home, but for what I'm hearing from people anecdotally is that you have to be really, really sick to be hospitalized. And that may change as these surge facilities come online, but right now they're pretty careful about introducing somebody with COVID-19 into the hospital setting where the majority of patients do not have COVID-19. So if a participant is sent home, they will need to self-isolate. So no laundering, no smoking. They can't go out and walk their dog. They need to stay in their apartment. And of course, this is really difficult to enforce. We're not on site, and it is their home. So depending on your building, that may or may not be very easy to enforce.
Great, thank you so much. I haven't seen any questions coming in right now. I did know that Dana mentioned Rhode Island is still doing contact tracing as of yesterday. Oh goodness, look at that. So I wanted to, you guys have been asking on the call for a while now about what to do if there is a positive case at your site. And so what we've been saying is to please reach out to your supervisors, talk to your agencies, because each agency is dealing with this a little differently. And we want to make sure that you're getting the guidance from your agency. But that being said, we did want to share what Cathedral Square has come up with to do at our sites. And if anyone is interested in getting this document or any of the things that we've shared so far with residents, please let me know. We are happy to share that with you. And basically what you see on your screen right here is what we're going to do. So if we have someone confirmed from testing COVID-19 as positive, we're going to post that there is a confirmed case within the community at our building. We're going to call family members or sponsors that we have permission to speak with, to let them know and to help sort of make arrangements and plans. We're going to use protective equipment if we have it, and if we need to go into the affected residents' apartment. We're going to continue to support them by phone, connect with PCP as needed, and in this case, we're going to inform our team leader, Pilar Paulson, is taking over sort of managing our emergency response. So in our case, we're going to inform her. This is definitely something you can share within your agencies and see if they have something similar, or if they want to use this, they are free to do so. And again, please let me know if you have any questions about it or if you want to see more samples.
Hi, Melissa. We have a couple of questions that have come into the chat. People were wondering if this was on STAR, and I just told folks that it's not because it's a Cathedral Square document. Were we planning to put that into STAR?
I think that we can. We'll just slap sample across it and share it. But again, the message right now is please make sure that you're talking to your agency. Each agency has their own response that they're going to be doing. And so we want to make sure that even if you're taking this and bringing it to your agency and saying, hey, here's what they're doing, can we do something similar? That's totally fine. I just don't want you to take this document and run with it and say, this is what I'm doing without talking to your agency. So yeah, I think that we can put sample on it, we can add to it, and then put that on STAR for people.
Okay. There's a couple other questions that came in. Somebody was wondering, Melissa Stockholm, what happens if there's 2 people living in an apartment when they send somebody home with COVID? Do we know
We have
that?
a great document. Yeah, we have a great document, Melissa, that we shared on the last follow-up call email. So if you go back and look at that, there is a CDC document that talks about how best to cohabitate when you have a positive case. So please go back and look at that email. It was in there. And then
It's also on STAR too, by the way. I uploaded that.
And if you have specific questions after you look at that document, definitely please reach out to Casey or myself. But it gives really great guidance around try not to share a bathroom if at all possible. If you have to share a bathroom, here's the best way to sanitize it. It is really, really good and pretty thorough. So I would take a look at that.
Jody Velarde said, I have a client in housing who had all the symptoms and was hospitalized in February before all this prior to testing. Should we consider this an alert housing if we don't know if the person was positive or negative?
I'm sorry, should we what?
Should we consider this an alert housing if we don't know if the person was positive or negative?
Honestly, Jody, I think that's a really great question. Casey has been saying from day one that we should be operating as if there is a positive case in our building because odds are good, whether we know it or not, there is. That being said, I know that there, like Casey mentioned earlier, our transportation unit is not working with any kind of congregate housing setting that has a COVID-19 positive case in it right now. So there is, you may want to try and make sure that you have a positive case before you go putting the signage up because it could absolutely impact services that your residents are able to get.
Awesome. Okay. And then there was one other question from Kat. She was wondering, in the event of a person in our building was positive and has a dog, what should we be telling them for an alternative for taking them out for walks? So I'll just put out there, Kat, we are working on this support plan that we kind of talked about last week in the call, and I'm kind of finalizing it as something that participants can fill out in terms of what kind of support that they would want in the event that they do get COVID. What are the things they want to make sure other people in their lives know? So that is coming out. Melissa, did you want to say anything else about that?
Yeah, I would say, Kat, that specifically, I know Cathedral Square, whenever we have a pet in place, we have sort of a backup plan in place as well. So if we allow a pet in a building, we do go through and say, if you were hospitalized, who would care for your pet? If you were sick and couldn't, who would take your pet? So what I think Cathedral Square is hoping to do is, best case scenario, find someone that can actually just take that dog for 2 weeks. Also guidance around they would need to take the dog and wash it immediately because it could transport COVID on its fur. But we are hoping that we can find alternate placement for these dogs for 2 weeks while the person recuperates so that they aren't having to take it for walks or having neighbors take it for walks. If that's not a possibility, I know Kevin Loso shared on the last call that I believe the Humane Society in Rutland had agreed to sort of temporarily house dogs in this case. So I think that this is an issue. And if you do run into one that doesn't have a backup plan, we might need to be looking alternatively, like thinking outside of the box. Does the Humane Shelter have anything? There's all of these volunteer, on Front Porch Forum things popping up. Could something like that work? So I'm going to move us along. These are great questions, but we still have like a lot of slides to get through. So, Casey?
So when we also when we have a case in our building, we want to make sure that we are checking in with those people daily if possible, and if they are agreeable to that. checking in about fever or symptoms of a fever, such as chilled, or are they staying hydrated? Do they have diarrhea? More and more people are reporting pretty severe diarrhea with COVID. Asking about shortness of breath and kind of any of those symptoms that might indicate they need to be back at the hospital or go to the emergency room, and being a connection between them and their PCP if that is needed. We can help participants plan and get access to additional food, clean clothes, pet food, medications, that kind of thing. And then also, if we have a case, we can help connect with family if that's desired by participants.
Casey, I think this was yours too.
Did we lose
I'm
Casey?
sorry.
There she is.
Nope, sorry, I was muted. Sorry about that. Had some questions coming in about why we want to keep doing assessments and why they still matter right now. And as you have seen in the priority workflow, they are not the top priority, but they can certainly still be being done. I mean, our priority is to make sure people have what they need and that we're checking in with folks. But as we have time and as we have more and more time to spend just talking with people, it's great to stay up to date on those assessments so that when this is over, you don't have a huge backlog. But I think more importantly, now more than ever, it's important to know how people are doing, and doing the assessment allows us to do kind of a whole system check on how they're doing. And while we can't address some of these things, for example, foot care, we don't have a way to address it. We can't send them anywhere unless it's really an emergency foot care situation. Just knowing that they have that need is really important. So asking about foot care, asking about mental health. And we know that the PQ2s right now are probably going to look different than they did 6 months ago for a lot of folks. There's a lot more depression, a lot more anxiety, and that's a normal response to this situation. And it's going to skew our data, and that's okay. We will highlight the sections that are from COVID-19, but it's important to be checking on mental health, checking on who people can call for help in the Lubin and for around social connections. And it's also a way to open the door to conversation. So we ask a question about how much exercise they're getting. And they may be stuck in their apartment, but that doesn't mean there aren't ways for people to exercise, whether they're doing chair yoga or dancing to music. It kind of opens the door to conversations about how to handle all of these things during the pandemic.
Hey, Casey, there is a question about this April 30th deadline for a grant deliverable connected to assessments. Is that still there? Do you know?
Actually, Amy, I just the chat, and
Okay.
and basically what I would say is just that, yeah, I mean, if you could please make sure any assessments that you've completed or entered into PHL prior to 4:30, that would be great, because on 5/1 we have to pull whatever we have in there. So just to make sure that whatever you get done in whatever capacity does get entered before 4:30 would be fantastic.
I think this one is still mine too. So one of the things that's becoming more clear as we are now 3 weeks into this situation is that there's kind of collateral damage or additional impacts that are becoming more and more a problem for a lot of our participants. And so a lot of preventative medicine is being pushed off or delayed. Med levels like INRs or drug levels for a lot of medications are much more challenging to get done. There is, as you know, a national shortage of the blood supply. We mentioned that visit policy changes at hospitals make it harder to access care. And there is a huge increase worldwide in abuse and in domestic violence. So we wanted to put up here a few hotlines and make sure people know that there are hotlines out there, especially around domestic violence. And to just have on your radar your participants who may be more at risk for abuse or domestic violence of any kind. Thanks,
Casey. So I guess the governor actually just mentioned this on the call at 11:30 today, and I wasn't able to listen to that call, but it's been on my mind anyway. So, increased suicide is necessarily inevitable during a crisis, but we have seen an uptick in suicide deaths in Vermont just since this pandemic began. And even more importantly than the numbers right now is the risk. And so basically what I'm sharing on the screen right now is something that was created by the Centers for Health and Learning specifically for the SASH You Matter program. And it talks about risk factors across the lifespan. So I've just circled some that may be even more prevalent for more people during this current crisis. Things like anxiety, fear, loss of loved ones, chronic pain, especially if you can't get to the pain clinic and that's how you are managing your pain, increased health issues, decreased mobility, decreased independence, increased experiences with death, isolation, loss of income, increase in feeling of burdensomeness. These are all just things that really popped out to me when I looked at this list, and it doesn't even mention one thing that's not on this list that I think is especially true right now is loss of services. So please keep this in mind when you're prioritizing risk level for your participants. We have that risk category breakdown of who you should be checking in with weekly, and it's based on high, moderate, low need. And I think a lot of that had to do with physical health, with mental health, and suicide risk, I think are also equally important to be looking at. So if you know of someone that maybe to go to adult day and can't do that anymore, or used to have homemaker services and doesn't anymore, someone that used to go to the senior center all the time but can't, please bump them into the high risk category. Please check with them frequently. Please remember that just asking the question, are you feeling suicidal, does not plant a seed. If somebody is feeling suicidal and you ask the question, the majority of the time that is going to let them know that you're a safe person they can talk to about it. And there is help that we can still be getting to people, albeit more likely than not remotely, but services do still exist and we can still make those referrals. Also, I wanted to talk about mourning alone. And so it's possible that our participants may lose people during this time, whether due to COVID or something completely unrelated. Regardless, though, the way that we're able to mourn those losses will be different. Mourning alone is a unique challenge, and SASH may be uniquely situated to help in that situation. I found this amazing article that you can see on the bottom of your screen here, but I am going to read a little bit of it for you, and I hate when people read on webinars, but this was just so important to me alone this week that I really want to share. There's little research on the experience of grief and isolation, but one concern is that people mourning alone will be more likely to experience anxiety, depression, and complicated grief, which is when people struggle to integrate their loss into their identity. Mourning alone is a unique challenge, but there are ways for people to address their grief and isolation. This is by Francesca Arnaldi, an end-of-life doula who works with terminally ill people and their families to prepare for death. Even without pandemic-related travel restrictions, quite a bit of support that they've been offering has been remote. She's the program director of the End-of-Life Doula Training Program at the University of Vermont. And in recent weeks, she's spoken with dozens of students, practitioners, and clients about techniques they're using to cope with this unique challenge. For people who are grieving alone, a meditation or visualization practice is important for addressing anger and anxiety that may come with death. Even if you don't have a professional guiding you, there's dozens of apps, and this article actually has a link to those that offer these services. People also find meaning in journaling, altar building, and private rituals, even when public rituals like funerals are off limits. And though nothing can replicate an in-person interaction, having someone to check in with through text message or phone calls on a regular basis is essential to maintain a connection with the outside world. So there is a high likelihood that we will lose participants during this. And when we do, there may be things that we can do to help our full panel cope with that. Whether it be sending out information about some of these things they can do independently, like journaling or private rituals, whether it's checking in by phone or text, or maybe holding group remembrances over the phone or online, And there is a whole list of online support groups that people can attend as well. And all of that is attainable through this link. So I will share that in the after call follow-up email. If you have any ideas of things that you could do to help your participants, please let me know. I'm happy to share those as well. Casey, did you want to talk about some of the new documents that we've created since the last call?
So we have created we've created this document. I don't know if this has been sent out, but it is up on STAR. This is to give to participants or to post in buildings if you're still able to do that, which is a document to help understand the stay-at-home order, social distancing, quarantine, and self-isolation. And this came about because of complaints from participants that other people weren't following the right rules, or confusion about whether or not they were allowed to go to the grocery store and what they were allowed to do when. So we created this to share. Hopefully it will stay up to date for a while. And it's kind of a combination of a couple of different visuals from different agencies. So that there's kind of 4 sections to this: stay at home, which is for everyone and for as long as you can, but things you can still do is go to the grocery store and other essential needs, go for a walk, get some exercise, keeping 6 feet away, pharmacy, doctor, veterinarian. For then a description of social distancing and what that means and being about 6 feet away. Another visual that I found helpful is 2 grocery carts away from other people. I think one of the hardest parts is in the grocery store, so 2 grocery carts away. And at the same time, encouraging folks to, as much as possible, use the drive-through services or delivery services if that's available, and to connect with folks online or by phone instead. There's also been a lot of confusion around the difference between self-quarantine and self-isolation, and even state agencies are kind of using them they're not necessarily using them the same way all the time. But quarantine is for people who have had an exposure. So that was especially for the people who have been traveling early on. So they've been exposed to somebody infected with the coronavirus, either known or suspected, or been in a high-risk area. And so that's for 14 days. Stay in your home except for emergencies. Ask other people to bring you food, and isolate as much as you can from your own family members and housemates, but definitely outside, not going outside your home. And then self-isolate is for people who are actually sick, either presumed or confirmed to have COVID-19. And there is, for how long is an ever-evolving question. How long can you go before you are allowed back out? And there was some new guidance from the Vermont Department of Health for healthcare workers on when they could return to work after sickness that just came out this week. But we want people to be at least 7 days after symptoms began. That's really tricky because there are people who have now been sick with the coronavirus for over 3 weeks. So certainly need to be fever-free, not coughing, those kinds of things. And most folks need to stay in their apartments. So please post these if you're able to at your site, or mail them to people, or talk about them when you're checking in on phone calls, just to make sure people understand where they're at. And maybe this might be helpful for people who are complaining about their neighbors, to be able to explain these different levels and different ways that people should be responding to this. I think the next slide is kind of a summary of these same things. But again, I want to reiterate the importance of having that 2-week supply available at all times, so that if you have to quarantine or you have to self-isolate, you have that stuff already in your home, or you have a system for having somebody drop it off to you.
Casey, Jody Velarde had a question about wearing masks, looking for links or connections to people who are making them or have access to them. So what we'll do, I think that's a bigger question. Maybe what we can do is, if people know of different folks who are making them or who have them available, if you want to let me know, and we can start some information on STAR around that. I know of a couple of places I've contacted that have them available, so I can start with those. And I know that there are some locations within the state that are donating and sharing and all of those kinds of things. That might be a way for people to know where to order them or where they can get them or where they can ask for them. So just send them to the SASH inbox or send them directly to me, rogers@cathedralsquare.org.
We also have a slide on how to make at the end on how to make one at home without sewing. So, you know, I mean, we can definitely put together a lot of those resources, but there is a slide that talks a little bit about that coming up too.
Also wanted to jump in. I saw a question about site visits, and those are still happening, but they're happening virtually in most cases. So you can reach out to Michelle if you have a specific question about a site visit at your panel, but in general, those are still happening virtually. This slide, we've heard from people around the state of different ways they're trying to continue, I hesitate to say group programming, but trying to keeping those kinds of connections with participants. I tried a phone Tai Chi class this week with some of my very experienced Tai Chi people, and that went really well. It was fun. Couldn't use Zoom because the internet wasn't fast enough, so running into those challenges. I know Maxine Adams did Zoom Bone Builders, which I heard was excellent. Jody Velarde showed that she's been singing together with some of her participants. We have the Resident Connect group phone calls starting this week at some of the Cathedral Square and buildings. And just wanted to kind of shout out to any others, to share any others that you guys are doing or trying, even if they were a flop. What are you trying, just to inspire each other to try new things right now?
Yeah, Molly commented that Maxine had more people on her Zoom Bone Builders than she normally does. And I have to say, Maxine covers all of Lamoille County, so she's literally driving just tons of square miles every day. And so we were kind of joking that it might be hard to get her to go back to in-person Bone Builders meetings when this is done. Thanks, Casey. So everybody keep chatting in your great things that you're trying, and I will be sure to collect those for the after call follow-up email. I did want to also say that your feedback on this call is so very important to us. It helps us tweak and improve the tools that we're creating because, as I've said time and time again, this is brandy new and we are all learning together. As a result of several conversations on last week during this call exclusively, but then also in emails following up, we've updated the COVID-19 individual plan again, and it's a little hard to see on this. I'm going to try to see if I can zoom in. I was going to actually go and show you where it is on the star page, but I know that my internet is not strong enough to handle a call and looking on the internet. So, but you'll see this box here about those COVID-19 status questions. So the participant reports having the following: fever, cough, shortness of breath, date they were tested, results of the test, those things. And that is the tab in that box. That is the tab that's now on PHL. So if you are able to go through and fill this out, we would love if you could put that information in PHL, and we will be able to then pull reports for you or add it to the monthly status report, whatever way that is the most helpful for you to get that information back. We will absolutely share that back with you. But most importantly, I just want to thank you all for your participation and feedback throughout this process. It's been hugely helpful. I also want to share some scam updates that we heard from Cove. Fake stimulus checks. So there are fake checks circulating right now. It will take at least 2 weeks for direct deposit to land in your bank account and up to 10 weeks for paper checks to arrive by mail. If you receive any checks right now, it's fraud. Telltale signs are checks written in odd amounts or include in odd amounts, or a check that requires you to verify receipt online by calling a number. That's how that scam works. Facebook text or social media messages claiming trying to get in touch with you. Scammers are reaching out to people online and sending text messages with claims that they are from the IRS or other government agencies and are trying to get in touch with you regarding your stimulus check. Ignore these messages. The US government will never reach out via social media platform or text. US Emergency Grants Federation is a fake website. Scammers pose as government agencies and will send a link to the website or something similar to you to verify personal information. The government does not do this. The government already has the information they need and will not reach out to you for verification of your social security number or other personal identification. Processing fees. Scammers pose as the IRS or other government agencies, claiming you can receive your stimulus check faster if you pay a processing fee. There is no such thing, and there is no way to speed up the IRS payment process. Any correspondence with the IRS or the US Treasury, they will never call or email you to verify personal information. This includes your social security number, bank account, anything that allows access to your identity. As soon as you receive a call or email saying they're from the IRS or the US Treasury, you should hang up or trash it. And as you know, these scammers are professional criminals and will use a variety of methods to steal personal identification and money. They use scare tactics and even attempt to befriend vulnerable people into trusting them. To report a scam or a scam call or an email, contact the Vermont Attorney General's Consumer Assistance Program. I should have put this on here. I will add it in the follow-up, but the number is 1-800-649-2424. So that is the Vermont Attorney General's Consumer Assistance Program line. If I read that out again, maybe Amy, could you type it into the chat? It's 1-800-649-2424. And we've actually had the Vermont Attorney General's Consumer Assistance Program come and talk to us, and they are really on top of the scams that are going on right now. You can check their website as well.
Just to put out there, I'm sure that Rhode Island and Minnesota also have that service. We don't have the number for them, but I'm sure that could be found.
You know what? We will follow up with that number in the email. So consumer protection number for both of those states. Thank you for the reminder, Amy. And then this is the slide. So the quote of the week this week is basically just that the CDC is recommending wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. So example, the grocery stores, the pharmacies, especially in areas of significant community-based transmission. So I mean, they were meaning things like the subway or buses, but all of those are going to be important going forward. And this is the tutorial. I honestly put this in here thinking that maybe, and we can put it on STAR, I thought it might be helpful to share if you're doing a SASH flash with participants. I tried it myself this weekend and it does actually work. I don't have coffee filters, so I wasn't able to do that part of it, but I was able to do the rest and it worked pretty well. So I think that sort of as a response to the cloth mask question, this could help. And then of course we will share whatever resources we can find about other ways to get cloth masks as well. And with all of this pretty heavy information that we've shared this week, I wanted to turn it over to Amy for a minute to talk about self-care.
Thank you, Melissa. So this week's joint SASH Coordinator Wellness Nurse webinar on Wednesday will be about taking care of yourself during a crisis. What's going on in our world right now is unprecedented, and we're in a crisis situation with no known end date. In order to be able to continue to do the important work of SASH, we have to also spend time taking care of ourselves. It's imperative that we find a way to practice self-care every day, even if it's minuscule and seems very small. Just doing one thing can make a huge difference. So I just put together a couple things that made me smile and honestly happy cry over the past few days. Melissa, could you go to the next slide, please? So first, there are many celebrities out there who are spending a lot of time at home and have started their own talk shows. One of them is John Krasinski, who was in The Office, and also Jack Ryan on Amazon. He started his own talk show called Some Good News, or SGN, and his lovely children made that sign. The most recent episode, he surprised a young girl who missed seeing Hamilton. So he had Lin-Manuel Miranda and the cast of Hamilton sing her favorite Hamilton song to her on the show, and it was beautiful. She was speechless. It was just this priceless little tidbit, which really made me honestly happy cry and smile at the same time. Will you go to the next one, Melissa? Many of the late night talk show hosts are also having their own at-home versions of their show, with guests joining them from their homes. So James Corden had Ben Platt from the cast of Broadway, the Broadway show Dear Evan Hansen. So he and the cast of Dear Evan Hansen sang this amazing song called You Will Be Found. I'm literally getting all teary-eyed just thinking about it sitting here. It was beautiful and so poignant, especially right now, just kind of talking about how we're not alone, and it was gorgeous. So if you haven't seen that, I highly recommend that as well. And one more, Melissa. So also look for the rainbows. Across the world, people are putting rainbows, and in some places, people are putting teddy bears in their windows to bring hope. And also for kids. So when kids are going for walks around the neighborhood, they can see the rainbows in the windows and see the teddy bears. It's like a scavenger hunt. And it's also just a really colorful way of kind of telling everybody that you're not alone. We're in this together. We're all doing this wonderful thing together. And so I encourage you also maybe to put some rainbows in your home, or put them where the participants can see them, or doing something so that they see this sign that we're all thinking about them and we're all in this together. It's a really great community building idea. We also have a lot of really great self-care options and ideas in STAR. There's that self-care pop-out page connected to COVID that I update pretty much daily with new ideas and new things that are going on. So I hope that you take a look at that. And I do hope that you all find something today that makes you laugh or smile, or at least take you out of your house. And I hope that you can all join us on Wednesday for our webinar.
Thanks, Amy. So there was a question coming in about how someone can find these things that you just mentioned. Are they on like the SGN or the other Happy Cry things that you mentioned? Is there a way that we can share links to those?
I think I'll just start a Happy Cry section on our self-care page. These are things that I've been looking for these personally on social media just for myself every night. This is kind of keeping me sane right now. So I will put something on the page on that self-care page and share some of these things so people can see them. It's just beautiful what the world is doing right now to kind of help take care of everybody and to put out there that we're all in the same situation together. So I will definitely put that out there to share them.
Thanks, Amy. So please join us. Also, the call this week is going to be all about self-care. And I've got this question slide up here. I just have to say, I went to Google a thing for today's presentation, and I noticed that the Google Doodle is, it's a thank you for all the frontline workers, but it is flattening the curve. And I honestly almost made me happy cry. It just cracked me up that, you know, here we've got basically Dr. Fossey on Google showing how to flatten the curve with a little globe behind it. So if there's any questions that you want to ask right now, please feel free to chat them in, and I will do my typical follow-up email. Hopefully get that out to you by tomorrow with any kind of links and other information. And I'm just going to let this go for a minute so that we can gather any questions that might come in. Thank you all so much for joining us. We really, really appreciate all of your feedback.